Hello. Like Hannah said, I'm Maddie Rose. So I did graduate from Anschutz January 2023. And I've been at 21 grams ever since. So I will talk to you today about my journey. I called it Bridging the Gap, Finding My Voice in Scientific Storytelling. Let's see if I can click. Cool. So brief agenda. I'm gonna talk about where I am today. Ooh, nice fun echo. How I got here. And then I call this familiar grounds and steep learning curves. So kind of the things I learned when I transitioned into medical writing that was both familiar and new. And then end it with advice for you, and you guys will have time to ask plenty of questions. Okay, so where I am today. So I am a senior medical writer in the medical strategy department at 21 grams. So for a lot of you, you probably have no idea what that means. So in order for you to understand what my position is and what I do day to day, I need to tell you guys about 21 grams and what we are. So we are a healthcare marketing agency, but we pride ourselves on being a little different than your traditional agencies. So what that means is if we look at the kind of recipe for healthcare brands and what they've looked like for the past 25 years, they've been a culmination of this recipe. So you learn about the audience through some double-sided mirror or other box checking method. You prove you didn't learn much by visualizing every brand's benefit as a variation of this. You've all seen these healthcare commercials where they're pointing at something that they don't show on screen. It talks about scary side effects like suicidal thoughts and tendencies and whatever. And then they serve the brand's interest first and the audience interest last, or sometimes never. So again, they're talking about, I'm going to make it complicated because it's science. I'm going to tell you about efficacy, MOA. I'm going to tell you about all these scary side effects, and it really doesn't like serve people's interests. So what that recipe ends up getting you, so an industry that deals with sickness and health, you get work like this: a split face with like before and after treatment, disease is a monster, something about taking back control, heart hands, my favorite, puzzles, balance, and yoga. So like raise your hand if you've seen any kind of healthcare that looks like this. Yeah, we all have, right? It's not very interesting. Meanwhile, sneaker companies get these cool kind of ads.
Those moments, we felt like it was over. But it's when we're given no chance. That we somehow found that last bit of strength to keep fighting. And then we did what no one thought we could, not even ourselves. We came back from the impossible, from being broken. We found a way when it seemed hopeless. We came back, we should have been long forgotten. We did it time and time again. Right now, we're fighting for something much bigger than a win or championship. But if we learn anything from sports, it's that no matter how far down we may be, we're never too far down to come back.
That's a Nike commercial. Nike sells shoes. So how are they making this inspirational commercial? Just because we're in healthcare doesn't mean the bar should be lower. It should be higher. There's so much more at stake than what pair of shoes or outfit you should be wearing. So in enter 21 grams. So 21 grams believes that medicine should feel more inspiring than sneakers. So I'm sure as all of you read my little description for the talk, I dropped that line in there. And that's because that's kind of the motto of our company and what makes us us. So 21 grams is named after this experiment by Dr. Duncan McDougall. So he weighed people before and after they died, and there was always a measure of weight that was unaccounted for. Anybody want to take a guess at what that weight was? 21 grams, exactly. Ding, ding, ding. So he equated that to the human soul. So he said, you know, every time somebody died, he did this multiple times, multiple patients, and there was always 21 grams of weight he couldn't account for. So he said, that's the human soul. So our company is named after that because we believe that there are 21 grams of a person that our work can affect. And what that 21 grams is it's that invisible something that it motivates people, it inspires people. And so that matters because instead of being brand first, like we've seen traditionally, 21 grams is connection first. So the more connections that we can make to the 21 grams within each other, our clients and our audiences, the more effective that we are. So our 21 grams way of working is that we uncover the 21 grams that make people tick. So we understand our audiences better than they understand themselves. so that we can make medicine more inspiring than sneakers. Again, why do sneakers make people feel so much? It's not talking about their benefits and their features. It's talking about tapping into that human spirit. And then ultimately, this leads to creating advertising and education that's less of an interruption, but it's more worth people's time and attention because it's advertising that actually gets them and speaks to them. So then we can get work like this.
Don't worry, it's fake. Fakes like those don't scare me. But fake meds, that's a different story.
Where can I find the Vitama cream? Ready?
Welcome, ladies and gentlemen, to Twitch Rivals. Today, we're taking the blood out of the equation to play the bloodless battle. Find that support, talk that out, figure that out so that you can grow as a person and like just feel all around better about life. Hey, vulnerability is the best bit. It's bad internet malware sent by keyboard warriors.
There. I'm Mary. It's so nice to meet you. Oh, apparently more than 10 of us will get through this window. It only takes one.
So it's like a fun scissor reel of some of the unbranded work we've done. Obviously, I can't show you the branded things because that's proprietary and confidential, but that's kind of a scissor reel of the different projects 21 Grams has put out into the world. And so going back to me, so I'm a medical scientist, a medical strategy department. So we are the scientific storytellers. So again, people don't tell bedtime facts, they tell bedtime stories. That was in my description also, little Easter eggs. But as a medical strategist, our job is to understand the complexities of the disease state, the treatment, and the data so that we can simplify it into a compelling story for our team, our clients, HCPs, but most importantly, patients and caregivers. And so we pride ourselves on going beyond, is this scientifically accurate, to what's important here so that we can inspire change. And so we really help establish the strategic foundation for the amazing work that 21 Grams gets to put into the world. So the projects I typically work on day to day, depends on what's going on during the year. Symposiums and speaker decks. So those are like bread and butter for my job. We also do advisory boards. So you get a bunch of doctors in a room for whatever brand what we're representing. We ask them questions about upcoming data readouts, competitors, our pipeline products, and then what we'll do is we'll culminate all those notes, give an output of like, hey, here's what was the discussion based on. Here's some strategic recommendations for what you should be doing next year. We also work on brand launches, so products that are not yet FDA approved, but are in the process of being FDA approved. So we will work with them to build their campaign and put together all of the work that they're going to put in as soon as the drug launches. And then we also do promotional materials. And so that's kind of a different side of the business, but a lot of the medical strategists are involved in that day-to-day work. So that can be anything from like HCP leave behinds to social media videos to brochures and those kind of things. So like I said, my bread and butter is symposiums and speaker decks. So I'm involved in them from the start, which means I'm putting together the outline for the talk. I'm also creating the title and description to advertise the talk to whatever conference it is. I'm also creating a discussion guide for the HCP interview. A lot of these talks are given by doctors. And so we have to create a discussion guide for the doctors, and then we interview the doctors. Depending on who the client is, either I will conduct the interview myself or I will sit in on the interview and take notes. Using that interview, we will build out the script and the symposium deck. We will also update the deck for whatever client comments, and then the deck itself goes through legal, medical, and regulatory review multiple times. We will update from there. We also then build a teleprompter side, create a discussion guide for the virtual rehearsal, updates post-virtual rehearsal, even though there shouldn't be any, there always are. And then to finish, so once the deck is ready, it's approved, I also fly out and provide on-site support. And so the night before, we do a dress rehearsal. So we'll have, again, the speakers go through all of the data, the slides. I'm helping them make any other adjustments that are needed. Again, there shouldn't be, but there always are. And then on the actual day of the symposium, I'm there on site working with the AV team, making sure everything is set up, the speakers are mic'd properly, and then helping them run the slides and the teleprompter slides as well. So this is kind of the bread and butter. A lot of medical writers, depending on what agency you're at, this is what you will start at doing, is making 1,000 PowerPoint decks, which is nice because I actually really liked making a PowerPoint deck. I didn't like giving the presentation. So this is kind of my sweet spot because I get to make the deck, I get to put in the jokes, but somebody else gets to tell them. And if they laugh, I'm like, great. And if they don't laugh, I'm like, you didn't tell it right. So when I say bridging the gap and kind of finding your voice in scientific storytelling, you have to bridge the gap between what the FDA wants you to say and what marketers want you to say. So the FDA wants you to say, this drug was shown to reduce the number of bleeding episodes by X%. Not very exciting, but pretty straightforward. Marketers, they're big dreamers. So what they want to say is that this drug changes the lives of everyone who takes it. Obviously, you can't say that. There's definitely a lot of rules and regulations against that. But it's your job as a medical writer to kind of bridge that gap and find what that compromise would be. Um, Obviously, I have to like water down because I can't tell you what the drug was. But the compromise in kind of a short, sweet way of what we ended up landing on is that we had the HCP speaker say it felt like the drug changed the game, particularly for our patients who had limited options before. There was a particular patient that comes to mind that we were able to start on the drug, and since he has started, he hasn't had a bleed. After we were able to find his ideal treatment option and routine to control his bleeds, he found himself able to focus on other areas of his life. So again, you're really trying to create a story. You want to go beyond the data. You want to go, what did this impact have on a patient's life without saying it changed their life forever, because you can't say that. So when it goes well, it's great. One of my favorite conferences was actually this year. So that was an expert kind of from this conference where we had two female doctors. One was a nurse, one was a doctor. And then the marketer was on stage interviewing them. And then they gave their feedback of like, this is what treatment was like before this drug came out and the challenges my patients faced. This is what the challenges were once they started the drug and like how their lives have shifted. And it went really well. It was a packed room. People thought these two doctors were friends for years. They had never met in person before this event. So it went really well. And that's just a testament to the work that we put in and the things we do behind the scenes to get them prepared. And sometimes it's cool because you work on projects that don't require words. So this is a campaign that we just launched for Mother's Day. So this was a really cool video that we got to collaborate on. This was mostly the promotional side of the business worked on this, but I got to consult on it. The director was asking a lot of questions of like, okay, what are treatments like before the drug? So we had to depict that. We had to tell them like, this is the equipment you need to show. This is how you need to show it. You have to show the sharps container when they switch to the drug that we represent and things like that. So it's really cool. And it's fun. One of my favorite things about this is that seeing people's reactions to it. So when we showed this at like patient events or community events, a lot of the mothers in the audience start crying because they really are depicted and they're like, this is exactly what it feels like. And so I think that's one of the cool things we get to do that you kind of don't get in grad school. And then we also do some other things. So I just got back from Florida last week and we put on a reading event. So they made a graphic novel about a kid with hemophilia A. That was pretty cool. And so we had never done an event like that before. All of us were like, I don't want to do this. This is going to go terrible. Why would you do this? It actually went really well and we were all like pleasantly surprised. And then that's one of the ambassadors who also has hemophilia A and he was talking about his reaction to the book and his experiences. And so it was a lot of fun. Um, and then I think I have the best team in the business. One of my teams, we recently had a conference in Colorado, so I took them to Estes Park, and they were all like, "What is altitude? I'm dying." So that was fun. The middle is a screenshot from a text our client sent to our account manager, and was like, "These two are amazing. You don't know the value they put into us." So that was kind of a nice shout out. And then again, my team came to Denver for a conference, and I took them to Osteria Marco. And we went to dinner. So it's a lot of fun, and like you get to work with really amazing people that you probably never would have met otherwise. But it wouldn't be honest if I didn't tell you the good, the bad, and the ugly. So let's talk about pros of the job and being a medical writer. You work on a lot of different types of projects in a lot of different disease states. And I think that part is actually really cool if you like that sort of thing. I know for me, like I was spent probably 6.5 years in grad school just working on thyroid cancer, and I was like, get me on literally anything else. So it's pretty cool. So I get to learn. Right now, I'm on two brands. One of them is in rare bleeding disorders, and the other one hasn't launched yet, but it's a lysosomal storage disorder. And so you get to learn about these different disease states and then the different therapeutic areas and what the landscape looks like. Like I mentioned before, seeing the impact of your work firsthand. So again, in grad school, I'm not seeing the impact of putting drugs on cells. Like it's just whatever happens in lab. I think this cool thing about this industry is you get to go a step beyond. So going from preclinical work to post-clinical work and like drugs that are actually in the market in the campaign and hearing from the doctors and the nurses about the patients whose lives they changed, and then hearing from the patients themselves how their lives changed. Like there's really no kind of measure you can put on that. It's just always awesome. It's always a different experience every time you talk to them. And like it reminds you like why you love your job. It is remote with opportunities to travel. So I do work from home. It's talking about rolling out of bed at like 7 to get on to work at 7:30. That part's nice, but I also get to travel. So like I said, I was just in Orlando. I was in San Diego earlier this month. I've also been to Atlanta and Chicago. So it is nice because it's like, all right, I'm mostly home and then I get to like leave and see people, which is great. It pays well. Anything pays well compared to grad school, but it pays well. I love my team. Like I said, I think I have the best team in the business. We have our team of medical writers that I work with, but then aside from that, there are different departments that I work with day to day. So we have like a project manager. She keeps everybody on track of like, here's your timeline. Don't miss this date. Where's my paper? Give me this. I have account manager. They deal with all the clients. And so they'll be emailing our clients and saying like, hey, let's kick off this project. Hey, let's have a meeting. And then if I have like a complaint, I like write it to them and they like use their communication skills to make it sound not super mean. And we'll send it and I'm like, work your magic. And then work-life balance. And so what I like about this job, like I said, it's remote, it's flexible. So a lot of the time I don't usually have to use PTO. If I'm like going home to Seattle, I will just work a little bit earlier. Um, there are obviously rules and regulations. We've had people who've like gone to Japan and tried to work, and you're like, that's definitely not allowed. But within the United States, like it's usually pretty flexible if you want to work from a different location, which I always like. And then I also have weekends. I cannot tell you how many times in the weekends in lab I've come in to do cells because your cells don't care if you're sick or it's the weekend or you have a mouse experiment going. Yeah, you don't have that in real life. So that's nice. And if you do, it's not very often. So cons, clients can make or break a project. So at the end of the day, in medical writing, you are in client services. And so you can have clients that respect you and are amazing. And luckily, I've had a lot more of those. You can also have clients that are like a little bit insane. So I had a client from France who came to us for some UCI medication that's not even available here. And she was gung-ho on her like tagline being prevention better than cure. And I was like, that's a terrible tagline. Like, what do you maybe you should do like react, like like be proactive, not reactive, you know? She was like, no, no, no. Prevention better than cure. And I was like, okay. So at the end of the day, like it's their project. You have to do what they want, even if you feel differently about it. Because sometimes there's compact timelines. So unlike grad school where you can plan out kind of your experiments and what you're doing when, you don't always get to do that. So especially when you're working on multiple brands, multiple accounts, you'll all have a lot of different projects going on. And so sometimes that can mean extended hours. It doesn't always. A lot of the times I'll work late, but like I only work till 3:30, so working late for me is like 5, God forbid. But sometimes that helps just to make my time easier and people aren't like bugging me all the time. I think sometimes it's nice to like work on a project and then not have someone ping you for something like every 2 seconds or invite you to a meeting or cold call you, God forbid. So sometimes I'll work just later just because it's East Coast hours, so they're all off for the day. I'm like, okay, it's quiet time. I can finally get things done. And then timesheets. Timesheets are the bane of everyone's existence. I've never thought it would be because you're like, it's just a timesheet. But like, I feel like when lab, you're really good at bouncing from thing to thing. And this kind of work, you are still billable. So even though I'm a salaried employee, we have billable time. So what that means is I have to track everything I work on and how long I work on it, which is kind of insane because if you have what I call undiagnosed ADHD, you're like, I'm bouncing from thing to thing. I don't know how I worked on. So you have to figure out ways and tips and tricks. And then if you don't submit your timesheet, you get locked out. And the only thing you have access to is your timesheet. So there are not ways around it, unfortunately, but you just have to find like kind of what works for you. Um, but all that to say, despite the good, the bad, the ugly, things are going well at my job. So we are called 21 Grams. So we have an annual event called the 21 Grammys, which is fun. And we give out 21 awards. And so what these awards are is they're voted on by your peers. And there are different things like the Maya Angelou Award, the Client Whisperer Award. The award I got was the Best Together Award, which basically what it was voted on was that this person is the collaborator of collaborators. This person doesn't drag 20 people to a meeting because they weren't sure who to invite, need the right expertise across the agency or a company as a whole. They're right on top of that. And so I really pride myself on knowing not just what I'm working on, but who I'm working with and making sure that the right person is in that meeting so that we can put together the best whatever project we're working on. So I think sometimes that's really hard in a remote position because you're not just like in an office and being like, hey, who are you? But I think at any time, if you can meet the people you work with in different departments, it is really helpful. I have one of my creative persons that I just bug all the time. And I'm like, hey, I need this pretty. Can you give me this image? And she's like, I got you. So it's really helpful. And I think this part was nice because it was like, I got this award. Obviously, we're obsessed with sneakers if you haven't noticed. So it is a gold sneaker, but it's fun and it hangs on my desk. So, how I got here, obviously I have a PhD, else I wouldn't be here. That'd be kind of weird. But I think it's interesting because, you think back of like, what did I want to be when I grew up? Nothing of what I'm doing now, that's for sure. I got a degree in biomedical sciences from upstate school in upstate New York in Rochester. And basically what that meant was just like I liked medicine, but I didn't know what I wanted to do with that of like, yeah, you like medicine, but like what are you gonna be a doctor? And it came down to like, do I want to be a doctor or do I want to go to grad school? For me, aside from studying the MCAT, which I didn't want to do, I liked it being a doctor as doctors have a set of tools or medicines that they can prescribe to patients, and they always have that same set. Versus a PhD, you have the opportunity to expand that toolkit. And so for me, I was like, well, I can make a broader impact if I do like drug discovery and find new drug targets. So obviously, I chose anti-shoots and cancer biology. I was working on that for like years on end. But I didn't know what I wanted to do for a career. It was just like, yeah, whatever. Like I like this. I'll do this for a bit. And then I think like my third year after comps, like comps is great if you've taken your comps. You have like a set plan of like, yeah, I'm gonna do all these experiments. It's gonna be great. And then the first one fails, and you're like, I give up. So you're kind of just like, all right, well, what do I want to do next? And I don't think grad school is very busy. It doesn't give you the luxury to just like sit and figure out like, what am I gonna do? What career options there are? The fact that this is even like a talk series is awesome, and I'm glad to see that. And people are like coming to learn more about different careers. I didn't necessarily have that luxury, but only because like you're busy, you're working on your update talk, your paper, your poster, whatever. There's never time to slow down. Well, it's all fun and games until COVID hits and you have to slow down. So my roommate got COVID. I never did, but every day she had COVID counted as a new exposure day for me, which meant I could not come to lab for 24 days, which is insane. And I tried to fight it tooth and nail. I'm like, no, 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 you have to stay home. And I'm like, great. So in that time, I really had to like stop and slow down and be like, okay, one, I don't want to fall behind because I'm trying to graduate. what can I do during this time that will benefit me, but also like, can I think about careers and things like that? It wasn't really that obvious, but at the time, I call this a rekindled romance. I wrote the intro to my thesis chapter. And I think in that doing that, I realized like I actually really loved it. I didn't always love writing about my science because you know how terrible your science is. You're like, this is never going to repeat. No one's going to accept this publication, whatever. Your intro to your thesis is like your time to shine and be like, this is the most important work ever, and it's going to make such a broad impact. And something about that, I was like, yeah, maybe I should look into like medical writing because this part was fun. I don't like any of the science that I have to talk about. So it really was like, okay, so that's when I really started to think about, all right, how do I get into medical writing? What is medical writing? I've heard about it. I don't know what people do, but I'm sure there's a way to figure it out. And you always hear this, you got to network to get work. It's so true. I hate to be that person that comes up here and is like, network, because you hear that all the time, but like it works. Lucky for me, there was a lot of alumni in the cancer biology program who went into medical science and science communications. And I talked to every single one of them. I got contacts from them and I talked to their contacts about what they do. And I think that's the biggest thing you can do. As one from my undergrad also went into medical science, had no idea, found out on LinkedIn, reached out to her, talked to her, learned about what she did. Um, and I think that it's really important to, again, you never know what you don't know, right? Until you talk to somebody. What's your job? What's your day to day? What do you like about your job? What do you not like about your job? I asked every single one of these people about it and then took meticulous notes and was like, all right, where do I see myself going? But the most important person I talked to was Jamie Camner. So Madison Rogers graduated from the CSC program here. At the time, we were both in cell signaling. I used to get all of her emails because my name's Madison Rose, her name's Madison Rogers. That was hard for people. So we became friends, and then we learned that we both had an interest in medical writing. So when the CSD put on a career panel and they invited Jamie Camner to it, Madison was like, "Hey, you like medical writing? Come to this panel." And I was like, "Amazing, great." I heard Jamie talk about 20 grams, giving a similar spiel to what I just gave, and I was like, "This literally sounds like my dream job." And she asked me afterwards, Madison was like, does anybody you want to talk to? I said, yeah, Jamie, 100%. So sometimes all it takes is an email and a little luck. So as soon as that career panel ended, I got Jamie's contact info and I sent her an email and I just said, hey, it was really nice hearing from you. I would love to meet in the new year to talk about your position at 20 grams. That's all it took. She emailed me back. She was great. She was like, yeah, let's set up time. I'll talk to you in the new year. I talked to her for like, I think an hour. And again, I asked her the good, the bad, and the ugly. Like, what do you like about your position? How did you get into this position? Why is 21 grams different? Like, is it hard having a PhD going to this career path? It's not, but we'll get to that. Yeah, so then I talked to her probably like a year before I even graduated. And then after I graduated, I reached back out and I said, hey, we talked about a year ago. I don't know if you remember, but I do. And like it really resonated with me. I really want to work here. Here's my resume. Please let me know if you have any positions. She emailed back so nonchalant and was like, oh, yeah, I'll pass it along to HR. They called me, I talked to them, and they were like, oh, we don't know yet, but 3 weeks. Like, are you in a rush? And I said, no rush. I have all the time in the world. I didn't because I was a postdoc in my lab and I was like, I need to get out of here. But sometimes you have to wait for the right opportunity. And so for me, it was kind of like, oh, the stars like happened to align. But I got a call 3 weeks later and I got an interview and it was great. So the interview process, honestly, it wasn't as intimidating as I thought it was going to be. There's only 3 interviews. The first one was with HR and talent acquisition, and that's like your general spiel of the company, the benefits, the whatever PTO, unlimited PTO, all that, and they like woo you. And like, does that sound great? And you're like, that sounds great. Let's move on. And then the second was with my manager who ended up hiring me. Funny enough, when they asked her, will you interview this person coming out of grad school? She really didn't want to. She was like, oh, they don't have industry experience. I don't know about that. Okay. But I did talk with her, and after I talked with her, she like loved me and immediately went back, was like, we need to hire her. So sometimes again, the interview can really save you because some people who might be reluctant to hire you, if they see like the great person that you are, the personality you have, how you can talk about your science, they can be impressed to like willing to take a chance on you. And then the third interview was with a member of her team. So, who you're going to work with for, and then who you're going to work with. She also hates when I tell that story because she's like, I did not want to hire you. And I was like, okay, it's funnier when I tell it. um, so where to next? So I got hired as a medical writer. After a year, I got promoted to senior medical writer. And then I've been in this position for about 2 years now. So I'm hoping to get promoted to associate medical director. Basically, same title as what I'm doing now. But I would have to probably manage like a junior writer on my team. So that's kind of like short-term goals. Long term, 21 Grams has an office in London. Fun fact, my mom lives in London and the office is 10 minutes from her. And I was like, wow, okay, I'm moving in. Um, but I did mention this to Jamie like pretty early on after I got there. I was like, oh yeah, like I kind of want to move to London, like work from that office. And she was like, oh, you totally can. Just give me like a month notice. And I was like, a month? That's crazy. So hopefully that's in the works. We'll see. As you know, America's kind of a sad place to be in. So I'm like, oh, this is my exit plan. Love it. Cool. So I want to talk about familiar grounds and steep learning curves. So again, transitioning from academia to medical writing, there are some things that are like kind of familiar, and that's kind of nice. So Med 101s, I call our familiar grounds. So Med 101s are fun because they're a lot like your thesis talk. So they're basically the what you need to know about this disease state and the drug. And so you start with the disease state, the background, the etiology, the epidemiology. You've done this 1,000 times, whatever model you're working in. I did a lot for thyroid cancer. I probably had it memorized for like 3 years after I graduated. And then you talk about like the journey, the symptoms, the treatments. And then you get into the product. So, like what your drug is. So, what's the unmet need? How is your drug going to fit that unmet need? You talk about the indications, the dosing, the MOA, the efficacy and safety data. And then you can have like some hidden slides about like deep into the efficacy and safety. And then the treatment landscape. So, what does the landscape look like? What's the current branded and unbranded campaigns that are in the market? Who are the doctors, who are the treaters, those kind of things. So I think Med 101s are pretty familiar. I actually really like giving Med 101s because it's just, they're meant to really train people not in your medical strategy department. So they're pretty high level. And then it's really to set up your team. So your creatives, your account managers, your project managers, so that they can take that information and build a campaign. You do Med 101s a lot when we're trying to win new business for a company. They will send out what's called an RFP or request for proposal. They'll say, hey, we have this drug coming to market. This is a disease state. Show me what you got. So the first thing they always do is they come to the medical strategy department and they're like, we need a Med 101. And it's all panicky. And you're like, okay, let's do it. Luckily, I don't work on pitches too much, but as the higher up you go, the less you're doing of like my bread and butter symposium decks, the more you're doing these pitches and you're putting together Med 101s. What I call the steep learning curves was seeing the big picture and thinking like a strategist. So like I said, I'm in the medical strategy department. The medical part was actually kind of easy because you're familiarizing yourself with the data, with what makes the drug great, why do people like it, what's the unmet need. The hard part was the strategy department. So we do a lot of what's called SWOTs, so strengths, weaknesses, opportunities, and threats. So every brand will typically do this, but creating a SWOT allows you to focus on like the key challenges you need to address and then the factors that you can use to leverage. So obviously your strengths and your opportunities are what you're going to leverage. Weaknesses and threats are what is working against you. So strengths are factors internal to the company or brand that help you. So things like strong clinical data, strong relationships with doctors or oncologists or things like that. Weaknesses are the internal factors that work against you. So, like, you have a high incidence of a certain side effect, like burning, not great. There's no long-term data that's not known in the field. Your opportunities are factors external to the company that work for you. So maybe there's a strong unmet need in the disease state. There's strong support from KOLs, so key opinion leaders. The competitors not known in the disease state area. And you're like, cool, great. And then threats are, again, external factors that work against you. So like HCPs are skeptical of your data. Patients are skeptical of your data. Patients don't talk to their doctors about their disease. Payers won't cover you. And so those are, identifying on your brand and what drug you're working on, all of these strengths and weaknesses and opportunities and threats can help you kind of know what do you need to lean into and what do you need to overcome in order to reach your target audience. Easier said than done. I want to see if you guys can do it, but don't worry, we're not going to do it for like a drug brand. That's kind of hard. Obviously, we're obsessed with shoes and Nike, so we're going to do it for Nike. You want to talk amongst yourselves, figure out what's a strength of Nike that would work, an internal factor that works for them.
Influence?
Yeah. Yeah. Anybody else?
And brand.
Yep. Yep.
Professional athletes.
Yep. I think that's all I put. Yeah. Strong brand recognition, strategic endorsements, innovative products, right? What are some of the weaknesses? So internal factors that work against Nike. Don't worry, it's meant to be hard.
Some gaps in design that a customer doesn't know of might be that for the that to for the supply issues, they're using maybe a little cheaper quality of the product with some which a customer may be allergic to, which something like that.
Yeah, yeah. Anyone else got a weakness that comes to mind?
Cost to benefit, is it worth the innovation for a normal consumer?
Oh.
Know what they're really selling?
Oh. Anyone else? That's what I put. Premium pricing, criticism sometimes on labor practices, sometimes on quality. What about opportunities? So external that are work in favor of Nike. This one's harder.
Might be along with like designing the regular shoes. They design shoes for people who have like maybe a deformed feet or with some kind of disease where they cannot wear the regular shoes. That would give them like they can promote that. They can say that we are also humanitarian.
Yeah. I think I had one more. Yeah. So I'll put that with innovative, but also sustainable products, health and wellness trends. I think that's been a big thing. People are all about sustainability. So like Nike has a lot of recycled shoes that they can use that people would want to buy because they're into that kind of thing. And then health and wellness trends. Yeah, many people have heard new year, new me. Let me get workout clothes. Like that's always going to work for them, right? What about threats?
Yeah.
And so like more focused or brands that have better recognition for specific use cases, like maybe like Adidas is zeroing in on like basketball shoes and are taking over that.
Yeah.
That's right. Right.
Yeah. What else? So I'll tell you anyways. Yeah, competitors. So like Adidas, Under Armour, Puma, knockoff products. So like, why would I pay $60 for these shoes if I can get these ones for like $30? They look kind of similar. Fluctuating economy. That's always going to work against you, right? Some people, consumers are shopping less. Dollar's not going as far. So again, easy. But this is something that like, again, this is like part of the job that grad school doesn't really prepare you for because we're not in business school. So having to learn this about each of the brands that I work on can be a bit of kind of a steep learning curve. Luckily, there's always support, at least in my company, to help me and like help me learn what's the SWOT for whatever brand I'm working on. But it is something that I was like, whoa, I don't know how to do this. And then the other one I love is acronyms. So we're gonna play a fun game of guess that acronym. SOW. Close. Yeah, scope of work. So SOWs are usually like the package of here's what we're agreeing to do for this pharmaceutical company. It's like for this much money, we'll do these things. ATU. One's a hard one, honestly. Right. That I was like, what is this? I was like, what is this? Attitudes, trends, and usage. And so you hear ATU a lot when they're presenting market research data. So they'll ask a bunch of either caregivers, doctors, patients, and they're like, here's our ATU data. And you're like, what is ATU? KOL. Yeah, you might know. Anybody else know what KOL is? Yes. Yep. Hear that a lot. So a lot of the marketers will be like, let's talk to some KOLs. And you're like, who are the KOLs? What was it? Key opinion leader. Yeah. TAE. Give you a hint. It's similar to KOL. Therapeutic area expertise. So some businesses will use KOLs, some will call them TAEs, so the same people, just people who know your space really well. TLLs. This one might be really specific. This is actually a position at one of the pharmaceutical companies, but thought leader liaison, which basically just means you have your fancy doctors. This is the person that talks to them. That's it. HCP. This is probably an easy one. Yeah, healthcare provider. So usually that means doctors and nurses, infusion nurses, those kind of things. DTC, not Denver Tech Center. We hear this one a lot in marketing, direct to consumer. So you either have your DTC or DTP side of the business, so direct to consumer, direct to patient, or you have your HCP side. So again, advertising in healthcare. And so different audiences do different things. POV. This one's not as tricky as it may seem. Yeah. So a lot of the time, in our work as medical strategists, when you have like competitors come out with data, what we'll do is we'll read it and we'll put together a POV for our team, which basically means like, here's what you need to know. Because obviously they don't know what the science means. They need to know what was presented, what's the implications it has for our brand, and what are the things that we should do maybe to overcome these. So my manager loves to be like, hey, new paper, POV, winky faced. I'm like, cool. I don't want to do that. Ooh, this one's my favorite. Yeah. When I first started, I kept getting people's like oohs. I was like, what the heck is an ooh? I'm like, oh, out of office. So these are things that you're like, you don't want to ask because you're like, you know it's a dumb question, but you're like, okay, but what does this mean? I think one of the fun things about 21 grams is that when you get hired, you do get assigned a buddy, which is like somebody senior to you who've been at the position, and you get them for like 90 days, and you get to ask them all your stupid questions. So I asked my buddy about all the acronyms. I also asked my manager, and she's like, this is a good test of my knowledge. I don't know what some of these are. So it's one of those things where you're just like, again, you're never gonna prepare for this because until you get into the business to know what acronyms they're using, but like they throw them around like you're supposed it's common knowledge, and you're like, oh, I don't know what that means. So advice for you, skills it takes to be a medical writer. First and foremost, understand the science. That's pretty easy. A lot of you, like you've read a ton of papers, either in your field, not in your field. You can understand them, you can discern them. The difference is that sometimes you have to do that very quickly. So like I mentioned, when you're working on a pitch, that request for proposal will come in, and sometimes you'll have like 2 days to get together the Med 101. So you have to very quickly do your research, understand what the science is to the level that you could explain it to someone who's not a scientist so they can put together a creative campaign. Ability to work independently and within a team. Again, you're scientists. You've been running your own thesis work. You're doing your own postdoc projects. You can work independently. I know for me, my PI was not very involved, so I was very good at doing this. And then working within a team. You know, again, if you had a lab that had other lab mates, you're probably pretty collaborative already. You can showcase those skills. Flexibility working on different projects. So like I mentioned, not everything is siloed. You have multiple projects with multiple deadlines. So you have to be able to make sure like you get this speaker deck done, but then also you're reviewing a route for a promotional piece, like a social media video. And so having the flexibility to know like, how long is this going to take me? When can I do this task first, and meeting those deadlines and deliverables? Because at the end of the day, like you are responsible for those. And then knowing your audience. So like I mentioned, DTC versus HCP, how you talk to a doctor is probably going to be very different than how you talk to a patient. A patient doesn't necessarily, sometimes they do, but they don't necessarily care about the data, the numbers. They want to know like how are other people doing on the drug? What was their story? What was their experience? Versus a doctor is going to be really critical maybe of, hey, what's the side effects? What's the benefits and things like that. So knowing who your audience is will tailor what your approach is to what information you're discerning to them. Also, aside from that, I learned this summer, I got the opportunity to work on some of the global work. So there was a conference that happens every year. Apparently, every year it changes locations. One year it was in Thailand and in Paris and Spain. And I was like, ooh, cool, we're working on this. It was in DC. And I was like, great, I don't want to go. But we had to work with the global clients, and we learned very quickly that global has very different rules and regulations than the US does. The US is a lot more strict with what we can and can't talk about. And then so having to, again, fix our work that they were giving, like the global clients were giving us, like, oh, just say this. And you're like, no, you can't. They're like, why not? You're like, the FDA won't let you. And they're like, what is that? So like being able to explain to your clients who don't necessarily know because they lived in Switzerland, and then also being able to translate, again, knowing your audience. It was still a global audience, but it was on US soil. So finding out like, okay, what level of detail do we need to give the audience so they were all on the same page to understand the benefits of our product. And then I always say the only bad experience is no experience, because you can't market no experience. Just because you're in a PhD doesn't mean that that experience isn't applicable to whatever job you want to apply for. So looking at my PhD experience when I graduated, I had like 2 peer-reviewed first author publications, 3 co-author publications. I had 2 grants that were funded. I did probably like 11 oral presentations, 13 poster presentations, and I trained and mentored 4 graduate students, and I did some volunteering and outreach. Again, on the outsets, you have this on the CV, and you're like, how am I getting a job with this? So I think it's knowing how to market yourself, knowing how those skills are applicable to what job you're applying for. So taking, for example, peer-reviewed author publications and grants. That's technical writing experience right there, right? You've shown that You got a paper peer-reviewed and published, that you wrote your science clearly and communicated it well enough for a journal to be like, we want to publish this. Grants are also great because grants are competitive applications, right? So not only did you write a grant and got it funded, you showed again that I can write about my science, make somebody else care enough about it to give me money. You know deep down, you probably shouldn't get money for it because you're like, what is this project? But they don't know that, so advertise it as such. Poster presentations and oral presentations, that's science communication right there. So like, again, being able to talk about your science to different audiences is really important, especially in medical writing. And then talking about the outcomes of those. So I did 13 poster presentations. I got 2 poster awards. Yeah, that's a low ratio, but at the end of the day, you're like, yeah, but I talked about my science. Somebody recognized it was pretty good, got an award for it, showcase that. So you're trying to brag about yourself. And then teaching, mentoring, and leadership. There's probably not a job on earth that doesn't require some kind of mentorship, some kind of training, some kind of leadership position. In grad school, you have that. You've trained rotation students, you've trained probably somebody else in your lab that was like under you. Again, put those on your resume and just put them as teaching and mentoring. Again, these are things you can talk about in your interview. And when they look at your resume, they're going to say, oh, talk to me about your technical writing experience. Talk to me about your science communication experience, those kind of things. And then last piece of advice for you is it takes a village. I know that this is your career and it feels really individualized and like it's all on your shoulders to figure out what you want to do with your life. But there are resources here to help you. The career office is a perfect example of one. I used Bruce so many times. I think he got sick of my email by the time I left. But I asked for feedback on my resume and my cover letter. I used him to have practice interviews. I think somebody asked pre this, how do you navigate going in an untraditional career path? Like my mentor had no idea what medical writing was, and she was like, I don't know how to help you. I had her read over my resume, I had her give me a practice interview. There's still things that are applicable that she can do that can still help you for your future career. And talk to people in the role that you think you want. And so again, you don't know what you don't know. There's so many different career choices and different things that you could be doing, but you don't know what it means until you talk to somebody. Ask them questions. Ask them for an informational interview. Doesn't mean you have to get hired by them, but you just want to know about their day-to-day life. Are they happy in their role? I mean, leaving grad school, like my biggest thing was be happy because grad school is miserable at times. And like, it's probably going to be one of the hardest things you ever do. But again, knowing that you can come out of that and then you want to find what you're doing next, make sure you prioritize what's important to you and ask the people in those roles what the important things are to you. Me, it was being happy. I'm like, do you like your job? Is it harder than grad school? Great. And with that, I'll take any questions. Yeah.
Is there anything that's recommended to do for a resume that might make it stand out? So just like certain like courses or certifications or like having a portfolio that you recommend?
Yeah, I think it's going to differ agency to agency, but coming from a PhD, you're always going to start at the bottom, which is a medical writer. So that's an entry level position that usually requires 0 to 1 year experience. So it's okay that you don't necessarily have quote unquote traditional medical writing experience. Like I said, take your PhD skills and the things you've been doing and highlight them in the lens of medical writing. I think if you can find opportunities, like it never hurts to do those. I think I worked with the summer research training program. I was like their communications director for like a semester and just like wrote them a newsletter. I put that on my resume, but like, did anybody ask me about it? No. So like, wouldn't stress yourself out about it, right? They know that again, the science part is harder for people to learn, and having a PhD shows that you can learn that. And so they're willing to teach you the other things of the business, like the strategy side that you won't necessarily get. It would have helped maybe if I took like a advertising class, maybe, probably. But again, you learn it on the fly, and like there's always going to be a learning curve, but you can succeed in the role. Yeah, I think you.
How do you think that this jobs or this field of medical writing is going to change with the advent of AI?
Yeah, we were talking about this earlier. Our company is actually big into AI. I think AI is great. It can be a really powerful tool, but it can't replace a medical writer. You still have a lot of the background knowledge that you've amassed like over the years or months you've been in the position that you just can't teach in AI. It would take like way too long. So I think for some of like the mundane things, like I have to write titles and descriptions for a talk that are pretty generic and unbranded, AI can do that. Love that. What they're not going to be able to do is script my deck and have all of the rules and regulations that the legal team requires, and the ways like different nuances of how you can talk about things. And I think there's not an AI in the world that can learn all of that because it'd be so hard to input it to teach it. Here's the PRC handbook. And like a lot of it's gray area. It's not super black and white, you know.
So how was that first year in, transitioning from doing lab work to, I'm assuming sitting all day and just writing and putting on that.
Yeah. So I think it also depends on when you join. So when I joined 21 Grams, it was in April. So they had already finished like two of their major symposium decks, and then they were working on another presentation in like the fall. So I had a lot, it was a lot slower of a build up, if you will. I had a lot of like slow weeks, but I think some of it for sure is like a little scary because you're like, I've never done this. I want to be good. But there's examples. So there's like a way of doing things. And so a lot of the time what I ended up doing was like, hey, it's like when they're like, we have a talk coming up, can you put the other title in the description? I'm like, can you give me past examples? And using that, and then you can figure it out. They're not expecting you to do it perfectly, but just knowing like you're willing to try, you're willing to put out the best you can, and then take the feedback and correct what you need to. It definitely is scary. No one likes not being good at things for sure. But it's not impossible. And I think it's like you always think like, oh, I'm never gonna be good and know about like know up to speed. And then when we hired a new writer and like I had to like help train her and onboard her, I was like, wow, I do know a lot. And like you don't even really realize it. And I feel like you feel that in grad school, right? Like you remember that first year in grad school when you're like, it's super intimidating and you join your lab and you're like, I don't know this disease area. But like you slowly start to amass knowledge and then you're like you look back and you're like, wow, I know way more than that rotation student. Um, so it's the same thing in medical writing, right? Like you're never gonna you know everything when you go into the role, but you gain the skills and the leadership to help you get up to speed. And that was a big thing for me when I was doing like informational interviews. I asked them like, what's the mentorship like? What's the support to help you get on board? Because it is hard, and you want to make sure you're supported because you don't want to fail. And so 21 grams was like, oh yeah, like the mentor is pretty hands-on. Like you have somebody working with you, showing you how to do it, and then reviewing your work. So like you feel really supported. I asked like every person in the position that they're in, how did it feel? Like, did you feel supported in this role coming out of grad school? Some of them said no, and I was like, cool, not applying there. And some of them were like, no, it's great. So again, that's a good question to ask in an informational interview. Mary Grace.
Hello.
Hello.
So how was the transition from studying only cancer bio to writing about like a lot of different diseases? And are there opportunities within the medical writing field to kind of specialize in a particular disease area?
Yeah, good question. I think I'm biased, but cancer is hard. And I think the only thing I think is harder than cancer is like immunology. And I'm like, but yeah, you know. But I also think like it's kind of refreshing. You have kind of like a invigorating attitude about it of like learning about a different disease state. You don't have to know it to the same depth that you know your grad school and thesis work, which is nice. And so it's not as hard. That's the skill that's familiar of like, you know how to read a paper and figure out what's important, what's the disease state, what's the unmet need. So doing that in different disease states, it's not that hard. It is harder because depending on what the disease state is, you're like, I don't even know how to say this word. But again, you can learn about it. There are a lot of resources that help. Like I looked at so many like nature reviews, like you know the resources from grad school, you just use them in your new position. So I still use PubMed all the time and like find reviews. There's like Guide Point Insights, which is like unique 21 grams has, but they have like a bunch of KOLs talking about disease state and unmet needs. And so listening to those can help you get caught up pretty quickly of like, okay, what's the model? What are they doing? And then most of the time you have a senior person who will tell you like, okay, hey, if you get caught up, here's the competitors you need to look into. And like they point you, you're never just like going blindly into it. Yeah.
So during the interview process, do companies generally do anything to evaluate your writing, like make you do some sort of writing piece during the interview?
Some of them do. So when I apply, I also applied to Open Health at the same time I was applying to medical writing. Open Health gave me a writing test. Not a lot of instructions, which I was like, I don't know what to do. But they like send you and they just like want a writing sample and then whatever. So 21 grams didn't or doesn't. I don't know if it's different depending on how you're applying. I think because I knew Jamie, who I didn't know at the time, but she was the executive vice president of the medical strategy department. So she was like high up there. and pass along my resume. And I was like, if I had known that, I don't know if I would have reached out. But it really worked out. But as far as I know, I don't think 20 grams does a writing test. What I would do again and have an informational interview with somebody in that company in that role and ask them like, do they give a writing test? What is that like? I think it's a really good question. And obviously like some will do that and some won't. I think ours, because we are more of like the creative agencies, care a little less about that. And so they don't give writing tests. But some that are like the medical writing portion, that's like publications and abstracts that you're writing for the company, they'll probably want a writing sample. Yeah.
What are the timelines for these projects? Like you said, it can be like 2 days to turn around and met 101 pitch, but like, are you working for a certain client for 3 months and then you're done on to the next thing, or continuously work with?
Yeah. So pitches are different. Those are the wild, wild west. Those are fast and furious and whatever. And they don't always happen. Depending, RFPs can come in at any point. Usually the higher ups deal with that and they'll pull in a medical writer to help with like the smaller stuff and then move on. But in terms of medical writing and like your position, you start off on like one brand, and then you work on whatever projects are needed in the medical education side of that brand. So for me, I'm on a brand that's rare bleeding disorders. And so I do all of their symposium decks. I do all of their like reapproval decks. So they're multiple use. They have like a speaker bureau service. So they'll have like a deck they present all the time. When that deck expires, I'll help update it and like update with the upcoming data. So I know my clients really well. I've been on this brand like 3 years now. And then I just started a new brand in the summer. So again, kind of like Mary Grace is saying, learning that disease state, getting caught up to speed. A lot of that felt like, oh my gosh, I don't know. I'm freaking out about this. I don't know it as well as I know this brand because I've been on this brand for 3 years. But even like 3 months have gone by now, and I'm like, oh yeah, I know this disease state pretty well. So you do work on that brand, and you're responsible for the work within that brand. And then timelines within that brand are most of the time pretty reasonable. So we have a symposium that's coming up next year, March and April. We kicked off that in October. So it's over the span of a lot of months. There's still like a lot of deliverables in the month, and the nice part is you have a project manager who tells you, here's your timeline, here's the next thing that's due from you. And then it's up to you to figure out when you're going to finish that work and then hand it off and then do the next step. But everything's really broken down and very like, again, structured, which is nice because you're like, I didn't have structure in grad school. I just did what I wanted. So it is nice having a different department. And then even nice, like in 20 grams, we also have an editorial department. So I'll like send things off and I'm like, all right, this is going through, it's called a cold read, which is they like read it and check for like grammar, punctuation, AMA style, things like that. I learned so much about the English language. I was like, oh, I don't think I know how to speak English. Humbling experience. Yeah.
For this position as medical writer, or
So medical writing, like majority are PhD. There are some PharmDs as well, but some kind of science background. I've never come across like a master's student. So it is come kind of advanced degree, either pharmaceutical degree or PhD. That's pretty normal. I think what for 20 grams specific is that the way you use your PhD is different. And so again, we're not putting out publications and helping people with like posters and those presentations. We're doing like more interactive things. We're trying to do more creative work to like get at people. So it's most of the companies though, like they all have PhDs or PharmDs. I feel like my manager is always like, the PhDs are a little better at this than PharmDs. I always laugh about that. I'm like, I'll tell nobody. Yeah.
From the writing jobs where you're doing a lot of like slide deck preparation, do they expect you to have prior like kind of graphic design experience or things like that, or do they teach you that or give you templates once you're in the job?
Templates. So the nice thing again is corporate America. Everybody has a department. So we have even a PowerPoint department, which I was like, what do they do? But a lot of the time, like I'll give them just the most basic things. And I'm like, hey, here's what I need. Can you make it pretty? And they turn around like, here you go. I'm like, wow, that's incredible. And then we also have like a creative department. So like those people who are graphic designers will do the arts. I think it depends on where your brand is in their life cycle. So when I came onto my first brand, it had been on the market for 5 years. So they already had all their templates and their graphs and their figures figured out. And then you just have to like pick up, plop it into a new deck. and then like maybe clean up some things. Some of my project managers will joke that I have a PhD in PowerPoint because there are some things I do know how to do that I'm like, I don't need to send this to the PowerPoint department to do. Like it's fine, I can do it. And they're like, wow, you're a wizard. I'm like, no, I've just done this before. I think at one time I made a figure in like BioRender and I gave it to my art department. I was like, hey, can you recreate this figure for me? And they're like, yeah. And so things like that. But you don't have to know any of that. I wanted to learn some of that stuff, but there's a department for it. You just got to tell them, you got to point them in the right direction because they don't know the science. So like one time they'll put, I forgot what they label. I think it was a receptor. Oh, we have a folder my boss and I call it the oh no folder. And they made a receptor. So we have like a monoclonal antibody binding to a receptor. And the art department made this image of like a V and then a curved. And we're like, don't think you want to show that. And trying to explain to them like, maybe you should have it bind to the side. Like it's just not the most appropriate looking thing. So things like that, like they're really good at making images, but they don't know the science and like how to do that. So that's when your job comes in of like, hey, this is where it binds. Maybe move it over a little bit and like working with them. I think there's a question over here.
She asked it about how many PhDs do you work with? I was gonna ask kind of similarly. Can you talk a little bit more about how your team came together? Like, were they from all over the world? Like, do they all have cancer bio PhDs?
No, I think I'm trying to think in my department.
Is that also your team or a different department?
Yeah, okay, so structures, fun. My team, so we have our medical strategy team. So my direct team is a team of 4. So my manager who originally hired me, Abby, is like my boss. I have a new manager, Matal, who I report to, and then we have a senior medical writer who's the same level as me. So we're a team of 4. Our whole department is like 30-ish people, I think, and everyone will have a different team structure. So they'll have a higher up and somebody underneath them, sometimes 2 people, sometimes 3, and they work on different disease states. So that's like all the medical strategy department. Aside from that, I have people I work with day to day in different departments. So account manager and project managers are like the 2 people I work with the most. So project managers are the ones who are like, here's your timeline, here's what's due when, give me this. And you're like, okay, you go. And then your account managers are like your client whisperers. Those are the ones who talk to the clients. They're the ones who send out all the emails and communications. They schedule the weekly status meetings, the reviews and things like that. And they'll send them your work of like, hey, this is ready for you to review. And then they mark it up of like, hey, here's the client comments, the things you need to fix. You take it back, you fix it, and then you give it to you give it to your project manager, who gives it to the editorial department, who will mark it up and then gives it back to you, and it's a whole thing. So it is pretty structured, but within my day-to-day team, there's a team of 4, and then there's my other team of like 3 people that I talk to every day.
The other departments.
In the other departments, yeah. Yeah.
I'm guessing your day-to-day, like you said, kind of changes as it goes, but like, do you feel like week to week it's relatively consistent, or do you kind of feel like your schedule is changing a lot?
Good question. I think week to week it's pretty consistent. I think again it depends where we are on what project. But a lot of the time, like with the symposium decks, so I'm in the middle of starting a new symposium deck, so we're in the beginning stages of like outline, title, and description. And then week to week I have like my reoccurring things. So we have like for our brand, we have a whole department who's on that brand meeting. So it's like your creatives, your account managers, your project managers talking about all the projects happening within the brand that you attend. That happens every week. I also have weekly status meetings for that specific project that I'm working on. So we'll meet with the client, and like a lot of those are more like logistic things that I don't have to deal with, but I attend the meeting just in case we talk about the data, or if they're like, hey, we saw this competitor do this, we want to do this. And you're like, okay, I'll add that. So like those are like pretty standard that go on during the project, but during any given week, it kind of just depends where you are in your project. So some weeks are like really light because I'll put together my speaker deck. It'll go in for the legal, medical, and regulatory review, and they take a week to review it. So like during that week, like that project's done. But because I'm on another brand, I'll probably have something else to do on that brand.
What was the learning curve like for writing in this style compared to, obviously used to just writing grants and publications, which is pretty different?
Yeah, I feel like academia, the best way I could describe it is like, I feel like you write really critical. You're very hypercritical of your own data. And you're like, you don't want to oversell your data, overstate what it's showing. it's like the opposite in writing because it's marketing, right? So like to them, it's the greatest thing ever. And so really learning how to switch that mindset from being like a cynic to being, rose-colored glasses. This is incredible. That was kind of a little bit of a learning curve because you're like, I'm not used to this at all. And then learning all the nuances of like what you're allowed to say legally, because like you can say the data and you can kind of talk about how it changed people's lives, but you can't make a quality of life claim. And that's like across the FDA. Like, and that's just like a rule in the US, which the global team was like, what? Different side of the business. Um, so it's a bit challenging, but I don't think it takes you more than like a month or two to get used to that kind of style. I think where it gets tricky is like when you have to build in like a brand strategy. So every year they have like a whole tactical planning brand strat meeting where they're like, these are our goals for the year and this is what our strategy is. And then you have to then make sure that your work is lining up to that overall strategy. So that can change during the year. It's usually fine because you know what the strategy is and like you're doing similar projects. And then towards the end of the year is when it starts to shift and they're like, we're focused on this instead. And you're like, okay, I gotta figure out how to like make sure that that is aligning to this overarching theme and like speaking to that audience specific. Um, but it's again, you're learning a new skill, you're learning a new thing. It takes time, but I don't think it's impossible. Once you get up to speed, you're like, okay, I can do this. A lot of it's kind of like, rinse and repeat. Yeah.
Like traditional industry jobs can be kind of volatile when startups get sold, companies get reorganized. Do you feel like you have pretty good job security, or how often does your company or anything in general restructure, mass layoffs, or whatever? You don't really hear about that.
Yeah. When I first started, we had like a couple round of layoffs, nothing too extreme. Our company was like pretty transparent about it. But I think day to day, like it's not something I really worry about, which is nice. My manager like will always ask her like, "Hey, how are we doing?" Because like recently we had somebody at a different department get laid off, and I saw it over the weekend. I asked my manager about it, and I was like, "That's kind of weird. Like, are we worried? Like, are we facing financial troubles?" And she's like, "No, it's performance based. You're fine." I was like, "Oh, cool." So not something you have to worry about. I think when you're lower level, it's not as big a deal, but I think being at a company that's transparent about it is important. So for our company, when they did have layoffs, they talked about like the reasons why and who, like not directly who it was, but like why they had layoffs. And then we're like, we'll be transparent with you. Again, if you're talking to somebody, like again, in an informational interview, I think that's a really important thing to ask. It's like, do you feel a sense of job security? Like I know I do, especially like with my manager, she will fight tooth and nail to keep me. And it's really good to have that person in your corner and go to bat. Again, it's not something I really have to worry about, which is super nice. I think as an organization, we do feel it because, we are hired by pharmaceutical companies. There are lots of rules and regulations going on right now, especially at the FDA. And so it kind of just constricts everything. You don't necessarily will lose your job, but then maybe the grand work that you used to doing, you have to scale back and scale down and make it work within the budget that they can now operate in. But there are teams to help with that. And like we have a financial department that does all of that and find out ways. One of the things I think we did to help compensate that is like they made a internal service for some of the services that our clients were outsourcing to other companies because it might be cheaper. So like, oh no, we have an option to make it cheaper for you. Any other question? Yeah.
So more into the finances, what are your benefits like, and do you feel like you're being compensated fairly for what you do?
Yeah, I think the nice thing is that PhDs, you already have a higher starting point, right? So I think the biggest advice, and this is something you never learned because you're in grad school, why would you know to negotiate a salary, is that you want to see like if you're looking at a position, I always say look at Glassdoor and see what they're being compensated. And then companies will ask you straight up, like, what are you looking for? And I always say give them a range. So like, where do you want to be at? Put that in the middle-ish. Well, maybe even put it at the bottom and then give them a range because they'll meet you somewhere in the middle. I do think the benefits at 20 grams are great. We do have unlimited PTO, which is nice. And like sometimes people are like, yeah, but is it really unlimited? Like, because sometimes unlimited PTO means no PTO. I've never gotten yelled at for taking too much PTO. One of my account managers has like 30 days off, I was like, that's crazy. She sent me a PTO request for like or an out of office thing for next year in December. I yelled at her. I'm like, it's November, first of all. I don't care about your out of office in 2026 in December. But it's pretty nice, and so that is nice having that unlimited PTO. Again, we have pretty good healthcare. Not as good as grad school actually has pretty good healthcare because I was like, I got everything done in grad school for like free. And then this year I broke my ankle and I was like, oh, being an adult's rough. But again, I think Denver itself has pretty good medical care. They have like payment plans. So if something does happen, they don't charge you interest. So it is just like pay your deductible and then just pay off when you can. But my company works really well about that. And then we have like open enrollment every year and they go through all your benefits package. Sitting there and like reading through all of that, I was like, I don't know what this means. I called my mom. I was like, no one taught you how to do this. Why is there not a skill in being an adult? Like, I have to enroll for health insurance. And then 401k, they do match your 401k, which is super nice. And so you can, I think they match up to 6%. So my advice is like, you make nothing now. So when you start, max out your 401k and let your company max it, and then just don't touch it. Because it's like, who knows? By the time you're gonna retire, you might be like 90. So just let it keep making money. But yeah, I think they're pretty good. And most of them are pretty like open about compensation and stuff. And I do think one of the nice things is that when I do have to travel for work, I do get reimbursed. So you have like all you have to do all your expense report, which is like kind of a pain, and like have an itemized receipt and all of these things. But they pay you back, and you're like, cool. I wish they could just give us like a corporate card and you didn't have to pay for it up front. So like that is something that's like a bummer because you're like, well, I don't have the money for this, but you find a way. Yeah.
Traveling, I know you mentioned traveling for these symposiums. How much of your work involves traveling versus working from home?
Oh, travel's like not a huge component for at least my position. I think this year I had 5 work trips, but they were spread out pretty wide. And that's only because I like for a while I was only on one brand. I think as you get higher up and you're on different brands, you might travel a lot more. But I love traveling. I think it's fun. You're like, I get to stay in a hotel, and it's the only time someone calls me doctor because I will register it and I put Dr. Rose. So that's a fun part. But I think when they hired me, she told me, my manager was like, it's probably like 10% of your job. A lot of the more younger staff, like the medical writers, you're doing the day-to-day support, so you probably always go to a conference. But some of the brands that you're on may not even like do conferences. That those can cost a lot of money because they have to pay for that sponsorship and get that package to even do the conference. So like I'm working on a brand right now, and we don't have any conferences that I know of that I'm going to, and I'm like, bummer. All right, let's do you in the back.
I guess just a curiosity question, but do you have the ability to just like extend your trip and then they still pay for your flight back?
Yeah, so that is one of the nice little hacks. They don't care when you leave and come back. The only thing they won't cover is like rooming, obviously. So if I had a trip in like San Diego, actually I did have a trip in San Diego in March. I think I flew in like Thursday and then I stayed till like Tuesday. The conference ended, I think, Friday or Saturday. But they said as long as the flight cost is like reasonable for what it would have cost to extend it as it would have cost to just come back, like with the plus or minus like $100, they're fine with it. You do have to book it through Concur, which if you've used in grad school, it doesn't go away. Yeah, you're like, I hate Concur. Tries to put you on like, it is nicer though, because at least Concur, like, or at least our company policy is that you don't have to take layovers. So like you can take the first direct flight, and then if you get back, I think after like 11 p.m., you are allowed to extend your trip one day, and they'll pay for the hotel room. So sometimes I'm like, and sometimes I'm like, there's not a flight that gets back. I'm like, no, no, no. This flight that requires a layover, and you get back at like 10:59. I'm not doing that. And they're like, okay, approved. I'm like, cool. Yeah.
So I know there are different levels of medical writer, obviously like junior or regular medical writer, senior. As somebody coming straight out of a postdoc or grad school, is it okay to cast a wide net and apply to positions of different levels, or is it with no experience should you really only be applying to like junior?
Yeah, so with no experience, it's usually going to just still be medical writer. Like you usually start at the bottom. Where it comes into play of like maybe being a postdoc is like you could probably get promoted quicker. But when they're talking about experience, they're talking usually about agency experience. So if you haven't had an agency job, it's usually those entry level positions. And like it's okay. It's hard to have an agency job because you're like, I've never done this before. Any other questions? Yeah.
So you don't have to do a postdoc for this?
No, we have had people that come straight out of graduate school. Like I came straight out of graduate school. My counterpart, who's a senior medical writer, also went straight out of graduate school into an industry job, and then she came from a different industry job to transfer to 21 grams. And that's how she got promoted because she was like, I'm moving companies. I want to be a higher role. And the nice thing is once you're like get your foot in the door and you're at a position, recruiters are always hitting you up of like, you'd be a good fit for this position. And you're like, I'm happy. Leave me alone. But that is an option. So like some recruiters will only do kind of the higher levels, like senior and above, but some can also do like entry level. So it is helpful if you can find a recruiter, because they'll also like get your foot in the door. They usually get at you an interview, and then they also will do your compensation negotiations because the more you make, the more they get paid. So they're like an aggressive advocate for you getting paid more. But
So, do you know of any recruiter? Because I have been trying to look for recruiters, but have never been successful.
honestly, they usually just pop up on LinkedIn. Yeah, they find me, I don't find them.
And then, yes, my next question is it okay to add you in LinkedIn?
Yeah,
Like, message any other questions?
yeah. I can give Hannah my company email and LinkedIn. Definitely reach out. We're always willing to listen to people. I don't know if we're hiring entry level yet. I know we are looking for like senior medical writers, but my head medical person is always like, good writers are good writers. If you know somebody, pass them along. So I also think like if you can get your foot in the door, it's a lot easier, especially if somebody can internally put your application in, because at least it's like, oh, you've met this person, you know this person, versus trying to apply to these positions, which are pretty competitive because they're remote and like everybody on LinkedIn can apply. So it's better if you can find someone you can talk to in the company and then ask them, is it okay if I send you my resume to submit? Yeah.
Do you talk to any toxicologists? Because I'm getting my PhD in. I don't know.
Ooh.
You mentioned PharmDs, so kind of like the flip side of that.
Yeah, I have not. I'm curious if on the marketing side, if they have more toxicologists and things like that. I mean, it's not to say you can't do it. A PhD is a PhD. It's not about what you learned. It's about how, well, not like what your PhD was in, but like how you apply it and like the general skills that you learned in your PhD, they're applicable to the job. So like one of my boss, I think her PhD was in like retinoic acid was her. I don't even know what it's probably like chemistry. It's like what? But this doesn't matter what you get your PhD in. You have a PhD, and that's all they really care about. 3 letters. They're never like, tell me about your cancer biology time. I mean, they do. So, like in the interview, have your elevator pitch ready. That's a really good test of your science communication skills. Can you explain your science to someone who doesn't work in your field, doesn't know what you do, in a really concise and almost like compelling way? I don't even remember what my interview pitch was. Apparently it worked though. So. Yeah.
Said your job was mostly like preparing slide decks. I was wondering if there's other roles that like people that you work with, other roles within that, like other than creating slide decks.
Well, for medical writers, it just depends on the brand and what the brand does. So at least at 21 grams, when you're getting hired in the process of interviewing, you interview with your direct manager, and so you can ask like, on this brand, what is like the most common deliverable you guys do? So for us, it is slide decks. Others barely do slide decks, and they have like sometimes they'll have like more posters or just brochure work or things like that. Like I say, like my bread and butter is slide decks, but I do like a ton of other projects I at least like help collaborate on. I might not be the leader on, but I've helped with like website designs and like relaying out their data, MOA videos, brochures, social media videos, things like that. A lot of that is the promotional side. But as a medical writer, they don't know the medical part of any of it and like the rules and regulations that they need to require. So you're still tapped in to do those things. But a lot of it's just going to be brand specific and what the brand is invested in and what they're doing. Yeah.
Do you miss bench work at all?
Like there was a time when I finished my PhD because I was, you leave lab to write your thesis, and then that's all you're doing is writing your thesis. And then I came back, and when I came back, I was like, yeah, I do miss this. But then looking back, I'm like, oh no. I think the biggest thing is hard for PhDs is that you fail so much, and like that's the act of failing is just mentally draining. And then when you leave and you go to a job that like recognizes your work and like the clients, like you succeed more than you fail. And like that shift is just totally different and it feels a lot better. But if you don't, if like you're the type of person who's like, no, I can fail, I don't care. On you keep doing research, honestly. Because that is some thick skin. But for me, I was just like, I feel like I was done with science after comps. Then I was like, I gotta stick it out at least and get my degree. Any other questions, thoughts, concerns? Like I said, getting a PhD is really hard. So like, remember, this is probably as hard as it's gonna get. I know, I feel like when I was in graduate school, I had talked to a bunch of alumni and they're always like, I'm so happy. And I'm like, I hate you. And you're like, you hate to hear it, like the whole like it gets better. I'm like, but it really does. Like that just environment of leaving academia and like doing anything else is like so refreshing. And you're like, wow, I have so much free time now. Like, what is this? Cool. You're welcome.